Now we shall be discussing how clotting time is done. What is the procedure for clotting time? First of all, you have to know what is clotting time. The normal duration of clotting time is between 8 to 15 minutes. So what do you assess? What do you infer yourself by looking at the clotting time? So clotting time is mainly useful for the assessment of clotting factors deficiency. For example, if you have any kind of clotting factor deficiency in your body, then the blood won't clot easily. This will lead to increased clotting time. Previously we have discussed that if the platelets are less, if there is low platelet count, thrombocytopenia, then the bleeding continues. This is called as prolonged bleeding time. In the same way, if clotting factors are low, if there is deficiency of any clotting factors, then the clotting time will not stop. The clotting time will continue. It will prolong. So in what cases do you find prolonged clotting time? So first thing, if there is deficiency of clotting factors like factor 8, factor 9 and factor 11, this will lead to hemophilia. So you have got hemophilia A, B and C, but overall clotting factor deficiency is leading to hemophilia. In the same way, vitamin K deficiency also lead to prolonged clotting time. So first of all, let me explain you the procedure of how the clotting time is done, and later on I will show you the practical procedure. So how a clotting time is done is that you have to explain the complete procedure to the patient before you start doing this clotting time procedure. Now take the patient's finger, prick the patient's finger and add a drop of blood on this glass slide. After adding a drop of blood, you take the pin and slowly run the blood upwards in this way. So let me show you. For example, you have a drop of blood over here. Now you are running the blood upwards like this. I will be showing it to you in a minute. So when you are running the blood like this upwards, after some time, let us say after 4 minutes or 5 minutes or after even 8 minutes, you will find a small string that is coming out of the blood. So that is a time when you have to stop your timer. And when you should start the timer, the moment you see a blood drop, the moment you put a blood drop on the slide, you have to start the timer. And the moment you see the string coming out of that pulled blood, you have to stop the timer. And that is your clotting time. Now let us do the procedure. Now I am educating the patient on the clotting time procedure, and now what I will be doing is I will take the patient's finger of choice. Now I will completely sterilize this area from center to periphery. For how much time? Obviously you have to do this for 30 seconds. Now I will take the pin. Now I prick the patient's finger. I see a drop of blood that is coming out. Now I will place this drop of blood on the glass slide. After placing the drop of blood, now I start the timer. Now what I will be doing is I will take the pin and start pulling this blood up. As you can very clearly see how I am pulling the blood up like this. You have to do it with patience till you find a string coming out. You see? Slowly the blood is getting clotted and slowly the string starts appearing. Now the string appearance is not so obvious, but definitely after some time, when all the clotting factors start to act by intrinsic and extrinsic pathway, you will find the blood clot. Now the current time is 2 minutes 40 seconds. Now you see a small string that is coming out. You see a small string that is coming out of the blood drop. Yeah, this is a small string which you can very clearly see now. Now immediately stop the timer. Now the current timing is 3 minutes 30 seconds. So this is the normal clotting time of the patient.